name is Maddie Desmond, and this is my daily health patient reassessment video. Before I begin, I would want to check the electronic health record for any lab values, and I would want to look at the doctor's orders and any other needed orders that I should be taking care of right now. I'm also going to check around the door frame, look for any markings or indicators that I should be aware of before I enter the room, like things such as fall risk. So now that we're ready to begin. Hi there, my name is Maddie. I'm going to be your nurse today.
Hi.
How are we doing?
Good. You?
Good. Can you confirm your name and date of birth for me?
My name's Michaela Desmond. I was born April 7th, 2004.
Okay, let's just check that with her wristband. Perfect. So what brings you in today?
I've been having stomach pain.
All right, and what were you doing when this pain first began?
I was just sitting on my couch watching TV.
Okay, has anything been making it feel worse?
No.
Anything been making it feel better at all?
No.
Okay, and what do you say the pain feels like?
Stabbing pain.
Just stabbing, sharp shooting, anything like that? Okay. Where exactly would you say you feel this pain?
My left side.
Left side, just up here?
Mm-hmm.
Just pretty concentrated there?
Yeah.
Okay. Using this scale, can you go ahead and rate your pain for me on a scale from 1 to 10?
Probably a 6.
A 6. Okay. So it's a little high. I'm going to talk to the doctor and see what we can do to maybe give you some meds or reduce that pain and make it feel better as quick as possible. And then how long would you say you've been having this pain?
A couple days.
A couple of days. Okay. Has it been intermittent or pretty consistent?
Pretty consistent.
Okay. All right. Good to know. I'm going to start off with a couple vitals. We're going to be using a temporal artery thermometer. So I'm just going to go across the forehead here. 98.3, that is normal, that's great. Next, can I see your finger? We're gonna take a pulse ox. Just let that sit there. All right, looks like we've got oxygen saturation of 99%. And then I'm just gonna take a listen for a minute here to your heart. So now I'm gonna just do some vital signs. Oh, before that, I'm going to be checking your eyes really quickly. So I'm going to be checking the pupil size. So the pupil size is about 5 millimeters, and then I'm going to have you take your glasses off, and I'm going to shine light into your eyes. So just look at me. Perfect. So her eyes dilate bilaterally, which is all normal. So now I'm going to be doing some vital signs. So first I'm going to be taking your temperature with a temporal thermometer. Okay, so her temperature is 98, which is in the perfectly normal range. Now I'm going to be doing a pulse oximeter. So her O2 stats are 97, which is pretty normal as well. Okay, I note that her pulse is 62, which is regular rhythm, and then I also took a listen for your respirations there, and those were 18 and unlabored, both in the normal range, so that's great. Next, we're gonna go ahead and take your blood pressure. First thing I'm gonna do is measure the size of the cuff with her arm. So that's good. And then we'll go ahead and just slide this on. Sorry, I'm gonna go ahead and put that on for you. Make sure it's all nice and tight. Okay. We are going to start by estimating the systolic blood pressure. So, you can go ahead and relax your arm for me. We are gonna, it's over here, feel that brachial artery, and found it. Go ahead and relax. Okay, and notice that her pulse has gone about 130. So when we pump this up, I'm gonna go up to 160. So let me grab my stethoscope and we'll take a listen here.
So I listened for a full minute, and the first 30 seconds I listened to her heart rate, which was 50, so that I would describe her to be 1 to be 100. And then for the last 30 seconds, I listened to her respiratory sounds, which or respiratory rate, sorry, which was 7. So
Okay, I got 138 over 82, which is also in the normal range, so that's good.
and then her respiratory sounds were
All right. Perfect. Okay, next we're gonna move on to the neurological part of this exam. So I noticed that she is alert and talking to me, making eye contact with me, things like that. Now we'll check her orientation. Do you know where you are?
Yes, the hospital.
Do you remember who I am?
Ms. Desmond.
And do you know what the date is today?
December 8th, 2024.
Okay, so she is oriented to time, person, and place, which that is good. And then we're just gonna ask her again, can you smile for me? Great, she's symmetric on both sides, so there's no eye drooping, no face drooping, and then are you having any trouble swallowing?
No.
If she was not oriented, we would use the Glasgow Coma scale, but I know she's having spontaneous eye movements, her motor response is purposeful, and then her verbal response is also appropriate. So that's good. She would score a 15 on that, which, like we said, she's alert and oriented. So then we're gonna take a look at her eyes. You could take your glasses off for me. We'll measure the size of her pupils. It's about 4 millimeters. Okay, now we're gonna check responsiveness. Go ahead and continue to look at me. Perfect. And I note that those are equal, round, and reactive to light, directly and consensually. So then there's that, and we already said she's, doing good. Just from looking at her, can I go ahead and pull her covers down? I note that her facial expression is relaxed. I know she's been moving all of her extremities. Her body position is relaxed. She looks aligned, sitting up in the bed, and things like that. Also, from just having conversation with her, her verbal response, she can articulate clearly. This also tells me that she has adequate hearing because she's able to respond to my questions. And then everything like that. Next, we can go ahead and I just look at her skin. She's got intact color and everything like that, which looks good. And now we can move forward and test her muscle strength. So go ahead and squeeze my hands. Good. Push towards me. Pull towards yourself. Same thing on the legs. Pull towards yourself. Good. Push towards me. Can you lift your legs off the bed? Great. Wiggle your fingers. Wiggle your toes. Notice any tingling or numbness in there?
No.
Okay, great. And then just so I know when she came in for the visit, her attire, what she's wearing, there's no foul odor. I know she has adequate hygiene and things like that, which are good. So next we're gonna move on to the respiratory system. If this patient had a nasal cannula or an oxygen mask or anything like that, we would wanna check the rate and flow, make sure that it's all hooked up properly, that she is getting oxygen, and that what's being administered is same as what's prescribed in the chart. She doesn't have any of that, so we're just gonna go ahead and move forward with listening to the lungs. So I'm just gonna have you take a couple deep breaths for me, and I'm gonna listen in a couple spots. Go ahead.
I thought that her diastolic blood pressure was about 72. A little lower. So now I'm going to do some just respiratory checks. So if she did have like any nasal tones or an oxygen mask.
All right, good. Same thing in the back. Just take some deep breaths.
Sitting well. And then I would also educate on taking deep breaths and using an incentive spirometer. If ordered a meeting. And then, have you been coughing recently?
Can I go ahead and lift this up a little bit?
Coughing recently, I would ask like the frequency of the cough and if she was coughing up any mucus. If she was coughing up any mucus, I would ask like the color of it and also the consistency and how frequent she is.
All right, wonderful. All of those sound clear. We don't have any wheezing or crackles or any other sounds like that, which is good. Do you have any coughing or anything like that?
No.
Okay, so if she was coughing, we want to note the frequency, the quality of the cough. If she's producing mucus, we want to know the color and amount of that, but she doesn't seem to have any of that. The other thing we would want to check for is if she uses an incentive spirometer. If she does, that's really for patients who are in bed for a long time. It's just going to help them with deep breathing because they're not able to get up and move around. So we're gonna just practice expanding that lung capacity. We do that once every hour so that she is able to still fill her lungs fully and things like that. And then that's all for our respiratory system. So then we're gonna go to cardiovascular. I'm gonna take another listen to the heart. And I'm gonna go through the aortic, pulmonic, Erb's point. Yeah, you can go ahead and set it if you'd like. Erb's point, mitral, and tricuspid. So we'll start with aortic, pulmonic, Erb's point. Can I lift this up a little bit? We've got tricuspid, mitral. We'll listen again with the bell. Okay, good. And I note that that rate is regular and everything sounds normal there. I also noticed that S1 sounds loudest at the apex and S2 is loudest at the base, which is all good. Next, I'm gonna go ahead and check her capillary refill. Could I see your hands for a second? Perfect, and I note that is less than 3 seconds. Same thing on the toes. Less than 3 seconds as well. While we're down here, we'll check for edema. No swelling in the ankles here, which is good. We will feel for that dorsalis pedis pulse. I notice that's equal bilaterally, so I'd say 2+. Then we have the posterior tibialis pulse. That is equal bilaterally as well. I'd say 2+. And now we'll do the radial pulse. Equal bilaterally at 2+. Other things we might want to check for with this cardiovascular system is if she has an IV. We just want to note that it's the correct type of IV, the rate, the flow. Again, make sure that's consistent with the electronic health record. And then if check the insertion site for any lesions, redness, skin breakdown, anything like that, which she is all good. And then we also want to ask her, do you use any compression devices?
No.
Any TED hose, anything like that?
No.
Okay, so she doesn't have those, but if she did have them, we want to make sure that they're functioning properly and returning that blood flow to prevent DVT. So that's all good for her cardiovascular. And then after that, we're gonna go ahead and just look at her skin, noticing the general contour. It's even, it's about the same. I know she has a history of eczema, so there's a little bit of patchiness in her arms, a little bit of splotchiness across the legs. She also has slight bruising in the back just from cupping treatment. But other than that, even. We're gonna check for temperature bilaterally, arms and legs, that is even. And then we're gonna do skin trigger underneath the clavicle here. Bounces right back, so she's hydrated. Other things, we would want to use a standardized assessment tool for skin breakdown. So I would use the Braden scale. I'd ask her, like, do you have a specialized bed or anything like that kind of helps her with her pressure spots? She doesn't. If she did, we would want to make sure that's functioning properly. Again, just make sure that it's in her chart and that's supposed to be used for her. And then we would also want to Try not to raise the head of the bed over 30 degrees because it's going to increase her risk for pressure injuries. And we also want to develop a rotating schedule to, again, reduce the risk of pressure injuries when she is in bed a lot. So that is her skin assessment, and after that we're going to go to abdomen. So I'll put the head of the bed down here and we'll look at her contour. All right, so I can just note that she's got a flat contour. Just doing general inspection. I don't notice any lesions, no scars, no incision sites, nothing like that. I'm gonna do a quick auscultation. So we'll go ahead and take a listen here, starting the right lower quadrant. Okay, and I note that bowel sounds are present in all 4 quadrants. And we'll do a little bit of light palpation, just checking for any protrusion or anything like that. Do you feel any pain when I
just on the left side.
on the left side that you were talking about? Okay. Yeah. So that all seems good. Again, just kind of looking, like we said, she doesn't have an ostomy or anything like that. No scars, no lesions, no color, no irritation, no anything like that on the stomach. Do you experience any nausea?
No.
Okay, and how are you, like, are you able to tolerate your diet pretty well?
I'd like to think so, yeah.
Okay, and what does a typical diet look like for you?
I like to think I eat healthy, like fruits, vegetables, protein, carbs.
Okay, so that's good. There's no changes there. It seems like she's eating a healthy diet. Everything like that, and then I'm gonna ask her, do you have bowel movements frequently?
Yeah, I'd say about every day, every other day.
Okay, and when was your last bowel movement?
Today.
Today, that's great. Using this Bristol stool scale, can you go ahead and describe the characteristics of your stool?
Probably number 4.
Type 4, okay. So soft, probably a light brown, dark brown color.
Yeah.
Okay, form stool.
Yep.
Perfect. Do you have any difficulty passing stool?
No.
Okay. So that's good. And then we will move into her genitourinary. Would you say that you urinate frequently?
Probably 5-6 times a day.
Okay. And if she had a catheter, we would also check just the flow, make sure the tubing is correct, empty if it needs to be emptied, look for skin breakdown, things like that with the catheter. And she said she thinks she urinates about 5 to 6 times a day. About how much urine would you say that you generally produce?
Cup and a half.
Cup and a half, okay. Do you ever have any painful sensation or burning when you urinate?
No.
All right, what is the typical color of your urine?
Probably clear or light yellow.
Clear yellow, that's good. That means she's hydrated. Is your urine ever cloudy?
No.
All right, that's good. And then do you ever have a foul odor with your urine?
No.
Okay, that's good. We've kind of ruled out UTIs or any infections or things like that. So that's good with her urination. And then I would also use a bladder scanner to check for urinary retention if she had any of that, which she doesn't. So that's good. And then just moving forward, when you go home, do you use any assistive devices to move, like crutches, wheelchair, nothing like that? She's able to get up and move on her own pretty easily. And before she goes out, I want to use a standardized tool to assess for fall risk, just making sure that she is able to move on her own without, being kind of thrown off. Sometimes things like medication can do that for her. She seems to be good. We can go ahead and put your covers back up. Is there anything else I can get for you today?
No.
All right, I want to make sure you got your call light. You do. I'm gonna check the locks of the bed, make sure the brakes are on, everything like that. Is this a comfortable position for you? This setup? Okay. We've got side rails up, and she should be all good to go. Thank you so much for your cooperation today, and I'll be back in shortly.
Thank you.
Have a good day, Miss Desmond.